This is your press on. You have only one limb, ah. Ito lang. Single tubing lang siya. This is your flow sensor. And this one is connected to your patient. One more swivel should be there.
This can be used for all ages, ma'am.
Adult and pedia and pedia only. Because below 10 kg is infant already. So, mayroon mo siyang bracket dyan, no? Meron siyang kg. Press enter. This one is doing self-test already, but before, asan na yun? Bilis. You can also use device, do device check here. Okay. Bago matapos yan, before this one finish calibrating, you should press this one. Yan. And do device check. Or configuration or ventilation. So, device check. Kung ayaw nyo naman mag-device check, kasi na-device check, if you don't want to do device check because you already did yesterday, just press the alarm reset and it will show the screen already. The first one is from your patient. The first column is for your patient. And this one is for your alarms and your settings. Second and third column is for your alarms and settings. For your patient, alarms and setting this one. So, how to use this one? You have 3 modes for this machine. You have your volume control, controlled mandatory ventilation, your volume controlled SIMV, and your spontaneous CPAP. So this one can also be used for your non-invasive mask. Okay. Press this one. Press if you want to choose one setting. Press long. If it starts blinking, press the rotary knob. And press again. This is your tidal volume settings, your RR, and your airway pressure maximum, and your FiO2. Only this one you can set here. But the PEEP and pressure support from your screen. You want to set the PEEP, press settings. There is 3 screen for settings. First one is your inspiratory time and your plateau threshold and your PEEP and your pressure support. This next is your trigger alarm and your brightness, the third screen. For your alarm also, you have 2 screens. This one is for the minute volume, the high and low, and your RR, your respiration. Second is for the volume loudness only. So how to press how to set? Just rotate the knob and whatever you want to set, you want to set the PEEP. Press this one until it na-highlight. And then
maximum sa PEEP, ma'am?
Usually all the settings are coming from the doctor, but we start with the 4 to 5 PEEP. Initial yan.
Safest na.
Diba, sabi ko nga, there is no standard settings for each patient kasi each patient differs, the body weight, the lung capacity of the patient. So, pressure support, if you want to choose, just rotate and highlight the number and press the rotating knob. Always your pressure support above PEEP. Above PEEP lagi yan. So, this one is your airway pressure. This one automatically from your patient will come. You just have to set the alarms. You see? Airway pressure high because your alarms is set below the parameter coming from your patient. So just put it up. What is this?
Parang dyan sa likod.
So you can see in the monitor, there is asterisk. This means that your patient is triggering breath. This one is your patient's spontaneous breathing.
Parang gagawin
Diyan.
If your patient has spontaneous breathing, this asterisk is the trigger for your patient. Huh? Maybe somebody will ask you, what is this asterisk? So this one is for your spontaneous triggering of your patient. Dali lang siya. So, set this one. That's it. Yun na yun. That's it for this one.
Ma'am, yung ECCMV, pareho to ng ECU.
Oo. Volume control, controlled mechanical ventilation. It becomes controlled when your patient is not giving spontaneous breathing. If assisted, your machine will give and your patient is also breathing. For your synchronized intermittent mandatory, both your machine and your patient is breathing, but it synchronizes to prevent the fighting with the ventilator. So, pag nag-breathe yung patient mo, your machine is breathing or not breathing. If your patient will breathe and your machine will both breathe because you preset the respiratory rate, the machine will adjust with your patient. It synchronizes with the patient to prevent fighting with the machine or yung alarm. Some alarms, it will give, for example, there is water here, condensation. It will give alarm here, kink tubings, yan, mga ganyan. Pag mag-alarm siya, pag mga kink-kink yan. Or natanggal yung ganito nyo, swivel, bukas. Mag-airway pressure.
Kung para siya ilipat sa sipa.
Sipa. Press niya lang to. Just press the settings. Once it starts blinking, press the rotary knob. Wait for it to blink and then press the rotary knob.
ER stuff.
Yes.